My name is Katrina Weir and I work for the Fragile X Association of Australia. I'm here with Professor Randi Hagerman from the University of California Davis Mind Institute. Randi is a world leader in Fragile X syndrome and Fragile X related conditions. She is a developmental paediatrician with more than 30 years experience working with families of children with Fragile X syndrome. And she is credited with the early discovery of FXTAS, or Fragile X Tremor Ataxia Syndrome. Randi and her husband Paul, a geneticist, have been in Australia for the past 12 days running clinics and speaking to families and healthcare professionals working with people affected by Fragile X. We're very, very privileged to have had them in Australia as their expertise is highly sought all around the world. Randi has agreed to participate in this Q&A video so that her vast wealth of knowledge and experience can be shared with people who are unable to attend her talks or her clinics. So welcome, Randi.
Thank you.
And thank you so much for your involvement in this important project.
My pleasure.
So most of the questions that I'm going to ask you today are questions that have actually been sent to us by our members. So that makes them very relevant, and it's highly likely that other parents and carers or even professionals working in this area will have similar questions and be able to learn from your responses.
Sounds good.
All right, so let's make a start. So firstly, are there any research developments that could lead to the prevention of Fragile X?
Well, there are, absolutely. You can prevent Fragile X syndrome with new reproductive technology. You can diagnose pre-mutation carriers or full mutation carriers who are mothers. And if they choose to have a normal child, they can do this with in vitro fertilization, or they can become pregnant and have early prenatal diagnostic testing and identify a fetus that may have a full mutation. And so some families opt to terminate an affected fetus, other families opt to continue the pregnancy of an affected fetus, but you can prevent it if you want to.
Okay. And what about the prospects for young children now and reducing the effects of Fragile X throughout their lifetime?
Well, I'm very interested in that issue, and in fact, we think that most of the targeted treatments that are known to reverse intellectual disabilities, some of these can be started at a young age. We know that antioxidants and some vitamins can actually dramatically help Fragile X syndrome in the mouse model for Fragile X. So we do recommend vitamins and antioxidants early on after a child is born with Fragile X syndrome. I'm very interested in the treatment with low-dose sertraline. That is, we carried out a study with individuals from 2 to 6 years of age with Fragile X syndrome, and our preliminary data shows that individuals with Fragile X treated with low-dose sertraline, that's 2.5 to 5 milligrams a day, have improvement in their language functioning and actually in also visual perceptual abilities and motor functioning too. So that's very positive. We're writing up that treatment trial now, but it has some exciting results. We also find that minocycline can be helpful in our controlled trials. So minocycline is another targeted treatment that lowers matrix metalloproteinase 9 or MMP9 levels that are way too high in Fragile X. Minocycline actually cures the Fragile X mouse, but it can have some positive behavioral effects in young children with Fragile X syndrome. Eventually, some of the other targeted treatments like AFQ-056, developed by Novartis, which is an mGluR5 antagonist study. We hope to carry out that study in young children with Fragile X between the ages of 3 and 6. If NIH funds a proposal that we've submitted to them, we'll see if that is helpful. We know that Novartis medication is not helpful significantly for late adolescent and adult individuals. but we think it might be helpful for younger children.
Right.
I think the younger you start some of these targeted treatments, the better.
And what about for people who are carrying the Fragile X gene, pre-mutation carriers? What's the latest thinking on medications for those people?
So pre-mutation carriers usually have normal intellectual abilities. In fact, some individuals can be very bright. Some individuals with the pre-mutation, though, can also have a second genetic abnormality, or particularly in the upper end of the pre-mutation range, the level of the Fragile X protein can be low, and so sometimes they can have developmental problems or even autism. We have done some anecdotal work, and we think that treatment of the anxiety and social deficits with low-dose sertraline can be helpful even in childhood, early childhood. But since most individuals don't have problems in childhood, but later on may have problems with attention and focus or concentration, then only if problems develop do we think they need, say, a stimulant medication for the attentional problems, or an SSRI like sertraline or Prozac for their anxiety. Now, individuals with the pre-mutation can have difficulties in adult life with anxiety or depression, or sometimes medical problems such as hypothyroidism or high blood pressure or even sleep apnea or migraine headaches, and all of those can be specifically treated so that they don't cause difficulty like stress and cause long-term brain changes. We think a healthy lifestyle with exercise on a daily basis, the use of antioxidants, avoiding vitamin deficiency, avoiding toxins in the environment like smoking or excessive alcohol intake or opioids or other illegal drugs. We think it's very important to avoid these toxins in the environment because the pre-mutation neuron is a little bit vulnerable to environmental toxicity.
Okay.
So we think a healthy lifestyle with lots of antioxidants, daily exercise, and treatment for medical problems that develop is very important for pre-mutation carriers.
Thank you. Excellent. So do you observe a change in the health status for people with Fragile X syndrome as they age? So, for example, are they more prone to seizures as they get older, or do other health problems develop as they go through life?
So for full mutation individuals with Fragile X syndrome, we have seen some health problems in adult life and in aging. Reflux is a common problem. Sometimes mitral valve prolapse or cardiac arrhythmias can occur. We do see problems with aggression, but that's mainly more in adolescence and adult life, particularly in males in early adult life, and usually that settles down with age. About 20% of individuals with Fragile X syndrome can have seizures. Most of the time seizures occur in early childhood, but occasionally they can occur at puberty, and we have seen occasional late onset of seizures in adult life. The most significant problem, I think, in aging is Parkinson's disease. We've seen that in about 20% of older individuals with Fragile X. Some of the antipsychotic medications like Abilify or risperidone could predispose them to Parkinson's disease. But I think the lack of the Fragile X protein dysregulates the dopamine system, and it's the dopamine neurons that die off early that cause Parkinson's disease. So I think it's intrinsic to Fragile X syndrome itself. There hasn't been much research in aging in Fragile X syndrome. There needs to be more research. We don't usually see tumors or cancer, but there is an occasional patient that can die of cancer, but it's really lower in individuals with Fragile X syndrome in general.
Oh, right.
It's not the case in pre-mutation carriers, but in those with Fragile X syndrome, the lack of the Fragile X protein may be protective against cancer. I have seen some individuals with Fragile X. We've actually seen 3 with a rare liver cancer, but these are rare problems. So we don't usually see these problems. Now, some individuals with Fragile X syndrome can decline cognitively and others do not, and we just need to do more research related to that. We don't know if they're at higher risk for Alzheimer's disease, but the amyloid precursor protein is increased in Fragile X, similar to the increases we see in Down syndrome, and Down syndrome can have early Alzheimer's disease, but we haven't seen those types of aging problems. But we just need to understand better about cognitive decline with age. You know, the Fragile X protein is very important for stimulating neurogenesis, of the making of new neurons during life, and it could be that the lack of the Fragile X protein makes it less likely that you would replace neurons as you age. And so that may be one of the reasons that a subgroup of individuals with Fragile X shows some cognitive decline. We've had a rare individual with Fragile X syndrome that has elevated message or has many cells with the pre-mutation and some cells with the full mutation. So they're more at risk for pre-mutation problems, and we have diagnosed FXTAS in a couple of older individuals with Fragile X syndrome who had elevated message. And an individual with Fragile X syndrome who was a chronic alcoholic during his life was found to have FXTAS in his 60s.
So lots of opportunities for further research in that
absolutely.
field,
We do need a lot more
Yeah.
research in aging.
So what about changes that affect the way people with Fragile X are able to live as they get older? I guess particularly with respect to their mental health.
So anxiety and sometimes resistance to change or autism can be a problem for at least 60% of individuals with Fragile X syndrome. And so there's medications like SSRIs, like Prozac or Zoloft, that can help with anxiety. I'm very hopeful that some of the new targeted treatments, they're being looked at in Fragile X syndrome. Minocycline is one. The IGF-1 analog that Neuron has developed is another, that this may be able to help improve cognition and aspects of Fragile X syndrome even in adult life. And there will be many newer targeted treatments that will be studied in Fragile X syndrome. So this is an age when we feel we're on the verge of more significantly improving the functioning level of Fragile X with these new targeted treatments and eventually curing Fragile X.
Well, that's an exciting prospect.
Yes.
Are there different strategies to manage anxiety in children versus adults affected by Fragile X syndrome?
Yes, we do think counseling can help, but also medications can help. And we do use SSRI medications in very young individuals with Fragile X syndrome, but at much lower doses than we use in adults or aging individuals with Fragile X syndrome.
Yeah.
So behavioral interventions, specifically focused on decreasing anxiety symptoms, cognitive behavior therapy it's called. We think that can be helpful, encouraging people to work through what causes the anxiety, give them lots of experiences so that they can get over their anxiety and treat with medications. I think some of the newer targeted treatments like the GABA-A agonists will also help with anxiety, besides the SSRIs or selective serotonin reuptake inhibitors like Prozac or Zoloft.
Yeah. All right, great. So let's move on to some of the associated health risks for people who are pre-mutation carriers. What's the latest thinking on some of the associated health risks, for example, thyroid problems or reaction to anaesthesia for this group, and what are any other risks that have been identified or that concern you?
So there are a variety of health problems that are more frequent in premutation carriers, things like high blood pressure or hypothyroidism, other immune problems or immune-mediated disorders like fibromyalgia, chronic pain syndromes like migraine headaches, or even neuropathy pain, numbness and tingling and pain in the lower extremities are very common in premutation carriers, particularly as they age. Migraine headaches, of course, can start early, even in adolescence or sometimes even in childhood, but they can respond to medications. High blood pressure usually starts in mid-adult life, as does fibromyalgia. And many of the medications for fibromyalgia, like gabapentin, Lyrica, also SSRIs or SNRIs, these are medications that increase serotonin and norepinephrine at the synapse, like Cymbalta, which is duloxetine, can be helpful for those symptoms. We recommend that individuals with pain symptoms should avoid opioids if at all possible, because we think that that may have some toxicity in premutation carriers to cause more white matter disease. Excessive levels of alcohol can be toxic, so there are certain environmental toxins, even the isoflurane, the inhalants used in general anesthesia, particularly as you age, can be toxic to neurons. And so some individuals that have had prolonged general surgeries in aging sometimes can develop the tremor and ataxia after surgery. So we recommend that if at all possible, you should avoid general anesthesia. For instance, if you need a procedure, if it can be done under local anesthesia, we think that's safer, but there needs to be more research because we don't know exactly what general anesthetics are most toxic for premutation carriers. Immune problems such as hypothyroidism are easy to treat. Other problems such as Sjogren's syndrome, which is dry eyes, dry mouth, or about 1 to 2% of premutation carriers can develop multiple sclerosis or lupus or some of the other autoimmune diseases, and those of course are harder to treat.
Yeah. So medication is obviously a key part of managing some of these conditions in premutation carriers, but what are some of the other wellness strategies that you recommend for some of your patients?
Absolutely. I think lifestyle changes are very important. Perhaps the most important thing is exercise.
Okay.
So exercise stimulates the making of new neurons. It actually increases the level of serotonin at the synapse. So it also increases mitochondrial function, and many individuals with the premutation can have low mitochondrial function. This can lead to chronic fatigue and sometimes more severe psychiatric symptoms, and even individuals with fibromyalgia can have mitochondrial dysfunction. So this makes the muscles weaker, people feel like their legs give out, or they can't exercise, or other symptoms related to low energy. So we're looking into ways to boost mitochondrial function, but we think antioxidants are important. We don't know if CoQ10 will be beneficial or not. We don't know about other medications that may boost mitochondrial function, but in general, antioxidants, omega-3s, vitamins. People are vitamin deficient very frequently, like deficient in folate or B12, or vitamin D is a very common deficiency, and so taking a multiple vitamin and antioxidants can alleviate that. So that's very important. So eating healthfully with lots of fruits and vegetables in your diet is very important. taking extra folate, B12, vitamin D, maybe a B complex can be helpful. We don't recommend taking iron unless you are anemic, because there's an iron dysregulation that occurs in premutation carriers, and sometimes iron can be deposited in the brain, which can further brain dysfunction. But we think a multiple vitamin that has some zinc in it is a good idea, because sometimes there can be zinc deficiency also. So if I was to say the one thing that could help carriers, it would be exercise, and the second thing would be a great diet with a lot of antioxidants, and the third thing would be vitamins and taking supplemental antioxidants. Also getting good sleep, treating insomnia. That's a common problem too in premutation carriers. And avoiding obesity, because that can lead to metabolic syndrome, diabetes, and that can cause more problems with brain function.
That's just such great practical advice that, I mean, we should all be following that sort of lifestyle probably, but it's fantastic practical advice for this group. Thank you.
We also think that yoga and mindfulness meditation can reduce stress.
Yes.
And many individuals, particularly those directly involved with raising kids with Fragile X syndrome, can be extremely stressed, particularly if their children are hitting them or abusive to them. That causes major stress and depression and anxiety. So treatment of that with yoga, mindfulness meditation, and using an SSRI or an antidepressant or antioxidant or anti-anxiety medication if you need it is very important.
Yeah. Thank you. So is it possible to predict if a person with a premutation carrier is going to develop FXTAS, and is there anything they can do to prevent that?
Yes, it is very difficult to predict if someone will develop FXTAS. We do see that FXTAS can cluster in certain families, so if there's multiple other individuals in your family tree that has FXTAS, and if your CGG repeat number is high, you may be more likely to develop FXTAS. Some of the healthy lifestyle changes that we've talked about and treating the disorders that could lead to more significant medical problems like hypertension or anxiety, and this can cause more problems with in the brain if not treated. We think that that's critically important, and avoiding general anesthesia if you can, and avoiding medical complications if you can. Avoiding falls, because oftentimes when people are just beginning to have balance problems, they fall and then they break a leg or break a hip, and that leads to general anesthesia, and then that can really cause a downhill decline. So being very cautious. Oftentimes working with a physical therapist can improve your balance and even can improve ataxia or falling problems, and can strengthen your muscles. So working with a physiotherapist we think is very important.
Yeah. Okay. And in your practice, are there any trends that you're seeing with FXTAS? For instance, are you seeing more cases of diagnosis, or is it about stable? So is there anything that you can comment on about what's happening, in your very busy practice?
So I do see more individuals with FXTAS, because I think that the medical community in the U.S. is getting much better at looking for the Fragile X mutation. Yeah. So the OBGYN doctors are testing women who have early ovarian failure or any type of ovarian dysfunction and finding premutation carriers, and then we carry out cascade testing among the relatives to find out who has the premutation and who has the full mutation, and then treating the problems associated with both of those disorders. So we're kept very busy. Now, my collaborator, Dr. Danuta Loesch at La Trobe University in Melbourne, she feels that FXTAS is far less frequent in Australia. And she thinks we have more toxins in the U.S. That may be the case. Okay. But I think that physicians here in Australia are not testing very commonly for the pre-mutation. They may be testing individuals with autism or intellectual disability for Fragile X syndrome, which they should do routinely, but then sometimes cascade testing doesn't occur throughout the family tree. And I think if you just look at most families, when you ask about the grandparents or the great-grandparents, you will find individuals that have had FXTAS or related aging problems in pre-mutation carriers. And so hopefully this trip to Australia has really stirred up interest and enthusiasm for testing for pre-mutation involvement, and for carrying out more research in this area.
Yes, so in another couple of years it'll be interesting to see if that situation has changed, particularly here.
I think it will.
Yeah. So as far as FXTAS is concerned, is there any advice that you can give to some of our members on minimising the symptoms, but particularly hand tremors and regulating emotional outbursts?
Yes, so in pre-mutation carriers, sometimes when individuals develop tremor and ataxia, sometimes irritability or outburst behavior is more commonly seen. And so in the treatment of FXTAS, we think it's important, if you're finding more irritability, that it's important to take an SSRI, because that can help with the irritability and the depression or anxiety associated with FXTAS. But outburst behavior is very common in individuals with Fragile X syndrome. Even high-functioning individuals, for instance, many girls with the full mutation who may have a normal IQ, but they still have problems with anxiety and mood lability or outburst behavior. Oftentimes a mood stabilizer can be very helpful for those types of problems. Oftentimes for anxiety we recommend an SSRI, but for mood stabilization, usually a very low dose of Abilify or even valproic acid, which is Epilim, which is an anticonvulsant, helps with stabilizing mood. For many full mutation individuals who have outburst behavior or aggression. Even lithium is a targeted treatment for Fragile X and does very well for stabilizing mood. So Abilify, low dose of Abilify or risperidone or Epilim or lithium or Lamictal or lamotrigine, another anticonvulsant, can be very helpful for stabilizing mood.
And just to finish off, what's on the horizon?
So on the horizon are more and more studies of targeted treatments for Fragile X syndrome. We hope to develop additional protocols. We're very interested in the natural cannabinoids like CBD, which is cannabinol, without the psychotropic of THC, which is in marijuana. But CBD, I think, could be very helpful for pre-mutation carriers and for full mutation carriers. And so we're looking forward to maybe carrying out a trial with that. There are other targeted treatments. Lovastatin is another one. We're just beginning an intensive language intervention combined with lovastatin, which is a statin medication, which downregulates this mGluR5 pathway. And we think that that combination of treatments could be helpful for Fragile X. I think in order to cure Fragile X, it's not going to be just one medication. It'll probably be a combination of medications. We're very interested in these early treatments that could reverse maybe some of the intellectual disability in the young patients. But thinking about new drugs like the Neurin IGF-1 analog, NNZ 2655, and hopefully those trials will take place also in Australia. That's a very exciting medication that we're studying right now in the US at multiple sites, but that study should come to Australia since Neurin is an Australian company. There's a lot of additional new targeted treatments that should be studied. bumetanide, which is a diuretic being studied in autism, but seems to help in Fragile X syndrome. A variety of new medications I think could be helpful. Metadoxine is one that can help with attention and focus. It's a B6 combination with a pyridinol ring, and that was developed by Alcobra, and that looks like it could be helpful too. So the future looks bright for many more targeted treatment studies, but I think you have to combine targeted treatments with intensive learning programs, either for language or for reading or attention and focus, like the CogMed program, which is a digital program, and other intensive educational interventions combined with targeted treatments, I think, is the name of the game.
Okay. Well, Randi, thank you very much for being so very generous with your time and for sharing your knowledge and experience with us today on this video. We really hope you and Paul will be back in Australia very soon, and that some of your predictions will start to come true.
Yeah, absolutely. It's my
Thank you.
pleasure, and thank the Fragile X Association of Australia for bringing us here. Thank you.
Thank you.